Good afternoon, guys. Now, discussion A today deals with elderly and mental health. So, here's the title: Mental Health Care for Older Adults, Recent Advantages and New Directions in Clinical Practices and Research. Okay. As a landmark synthesis that reframes how we understand, treat, and support mental health in aging populations. Drawing from global research and clinical insights, its challenges outdated paradigms and offers a forward looking roadmap for practitioners, policymakers, and caregivers alike. The, men- the mental health landscape, a global imperative. With the world's population aging rapidly, projected to reach over 2 billion people aged 60 plus by 2050, the mental, the mental health needs of older adults are no longer uh, peripheral. They are central to public uh, health planning. The article underscores that older adults face a disproportionate burden of mental disorders, often compounded by multi morbidities, co occurring physical and mental conditions, social isolation and loneliness, caregiver stress and burnout, ageism, and systematic neglect in healthcare systems. Yet the authors argue that aging also brings strengths, resilience, wisdom, and emotional regulation, and pro social behavior, um, qualities that can be harmed, harnessed to promote mental well being. Clinical priorities for high impact disorders. The paper zeroes in on four conditions that account for the greatest years lived with disability among older adults. Each explored through the lens of diagnostic complexity, treatment variability, and service delivery innovations, with a strong emphasis on comprehensive assessment and coordinated care. Beyond the clinical, beyond the clinic. Social and structural detriments. Mental health later in life is shaped as much by social contexts as by biology. The author highlights negative drivers, ageism, uh, poverty, inadequate housing, uh, fragmented services. Positive drivers, community belonging, intergenerational relationships, cultural identity. The advocates for interventions that go beyond symptom management, integrating social supports, caregiver education, and community based programming. Positive psychiatric and cognitive vitality. A standout contribution of the papers is its embrace of positive psychiatric psychiatry, psychiatry of aging, a framework that emphasizes normal cognitive aging as distinct from pathology. Growth oriented interventions like life review, therapy, mindfulness, and meaning centered psychotherapy, reframing aging as a time of psychological flourishing, not uh, inevitable decline. This approach not only combats stigma but also opens new avenues for prevention and early intervention. Research horizons and implementation science. The authors call for a robust research agenda that includes treatment modulators and uh, mediators to personalize care. Pharmacological safety, especially regarding cardiovascular and neurological side effects. Caregiver well being is a clinical outcome. Public policy reform to address ageism and mental health stigma. They emphasize implementation science, the translation of evidence into scalable, culturally responsive models that work in real world settings. Paradigm shift in geriatric psychiatry. Ultimately, this article is a rallying cry for a holistic, equity driven transformation in how we approach mental health in aging. It urges stockholders to reimagine aging as a phase of potential and contribution. Build systems that integrate mental, physical, and social health. Center care around both the older adult and their family caregivers. Invest in culturally adapted community-based interventions. If you'd like, I can help map these insights into specific intervention frameworks, say for rural African American elders or older adults navigating addiction recovery. We could even co-design a toolkit phototyping that blends clinical evidence with cultural wisdom, ready to dive deeper. Okay, guys, so that is A for you. I'll be back on shortly with B. Give me a bit for B, please. And I'll be back on with that for you. For now, Gator Wellness. Take care, folks.